Good afternoon, everybody. My name's Niki Maclean. I'm the director here at the Ombudsman's Office, and I'm really delighted that you're able to join us today for our very first Speak Up Week session. And I know there's lots of activities going on in boards at this time as well, and I hope they're going well. It's been really interesting to see what's happening with NHS colleagues and activities that are being advertised and participated in. We know that it's having some impact because the number of calls that are currently coming into our INWO advice service this week has gone up slightly. So it's definitely generating some interest and some people seeking advice, which is exactly what we hoped would happen. So that's great. I'm just going to say a few words before I ask my fellow panel members to speak. And the purpose of today is that it is a discussion session and there is an opportunity for you to ask questions, and we'll try to get through as many of those as possible. But as I say, we do also have our INWO team provide an advice service, and they are always there to help. Sorry, I'm just checking. I'm getting a message from someone to, is that better, Fran? Is that what you're asking me to do? Okay, I'll keep going unless I get a different instruction, but I'm hoping everyone can hear me okay. So as I was saying, that we do have an INWO advice service, and it's open for you to contact at any time for some advice and guidance on either the standards or in terms of how to practically go about raising concerns. So as I say, it's fantastic that we're having this first week. I'm sure, like many of you, this has really given me an opportunity to reflect on and think about what it might be like as somebody that is thinking about and in a position where they might need to be raising concerns. I've never been in that situation, or not knowingly been in that situation, but I did have an experience in my early career, a different career, where I had an experience where I'd identified some health and safety concerns, and I did try to raise them within my organisation. It wasn't within a health setting, and when I tried to do that, they were basically ignored. But I think at the time I was quite young, I was quite early on in my career, and I quite quickly took the decision to leave that environment and go to another environment where I was in an organisation where my values and beliefs that aligned more with that organisation. So I haven't got an experience of being a whistleblower, but I think it's really helpful to think about what it might be like to walk around in someone's shoes in that situation, and I think that it must be quite a scary place. And I think that the more that we can do to build an environment where it makes it less scary and where people feel able to come forwards and talk and not have to wonder if they're going to be the one that is going to have to raise a concern, the better for all of us. So it's I'm here talking to you today, but it's obviously I'm here on behalf of the SPSO. So I want to just welcome you all on behalf of the Ombudsman Rosemary Agnew and also the INWO team. I know many of you will have met colleagues in the INWO team, including Fran Richards, who's the INWO manager, and Fran's on the call today, as are my INWO colleagues, and can always answer some tricky questions if I'm not able to. The session is being recorded, so if you've got colleagues that haven't been able to come along today, then they will have the opportunity to be able to watch it at a later date. As I said, I know boards have been undertaking lots of different activities. SPSO has also been putting lots of information out there, including an interview between the Ombudsman and the English National Guardian that went out on Monday. If you've not had an opportunity to look at it, I would encourage you to go and view it. It's got some really good insight into the implementation of the speak up culture, both in England and obviously in Scotland, and on our journey now. But for me, I think one of the most striking things to note is that both of our organisations, both of these processes have been set up as a result of Francis and because of the mid-staffs report. And we know because of these and because of other reports that we know from the evidence of these and other reports that there is now decades of evidence to show that if we don't have effective mechanisms for people to raise concerns, that is where patient safety issues arise. And it's also about creating a safe environment for the staff working in those environments as well. So without further ado, I'm going to introduce our panel. So we've got three panel members today, and I'm very grateful for them and their time. So we have Simon Watson, who is now the Medical Director of Healthcare Improvement Service. Morning, good afternoon, even, Simon. I'm not quite sure why I think it's morning, because it's been quite a long day already. But thank you very much for joining us, Simon. Simon's obviously coming with a regulatory hat, but also having worked very much as a practitioner, and also from the perspective of a sector that is really new to trying to embed this process. We then have Stewart Hughes, who is Head of Group Security at SSE, and Stewart was explaining to me earlier that Stewart's experience has been built up over a period of around 9 or 10 years. So again, you have a different perspective, a different environment, and a longer time period to try to establish systems. And I think he has some really good lessons for us, given that this is relatively new for our environment. And then we have Sean Parker. Welcome, Sean. Nice to see you. And again, Sean comes from the aviation industry, so works for the Civil Aviation Authority, which clearly has a very long history of safety and safety reporting. So an even longer history, but again from a regulatory perspective. So I hope that means that we're going to have a really rich and varied conversation around the topic of trust and transparency. I'm going to just start off by asking each of the speakers to just introduce themselves and say a little bit about their journey, perhaps, and their experiences to date around this area. So I'll maybe ask Simon if you're okay to speak first.
Yes, Nikki, thanks very much indeed. I'd be very happy to do that. And I'm going to mention two personal stories, one where I was the speaking up person and the other where I helped somebody, and they won't take too long. I've not talked about either of these publicly before. The first one was my own experience of speaking up, and just to echo your point about what must it feel like to be there, it was easily the worst experience of my career as a doctor. And it was right at the start of my career as a doctor, which is now frighteningly 26 years. Yes, it's 26-ish years ago. I'm not going to name names, but you know, some might be able to figure out where I'm talking about if they know my career. Right at the start of my career, my first job, I was aware of an awful episode where a patient came to serious harm because when they left the emergency department of the hospital we worked in, because the emergency department was worried about losing pumps and medical equipment, they would disconnect the drips with life-saving medicines for a patient before they left the emergency department, so they wouldn't lose their equipment, on the basis that they'd be reconnected when they got to the ward. And on this one particular day, a patient actually took a lot longer to transfer to the ward and came to serious harm. So just to be clear, we're talking about the mid-1990s, so a very long time ago. But we were aware of this episode and the harm it did to a patient. A week later, I was in the same emergency department with another patient who was on a life-saving emergency drip, and the nurses came along and disconnected it for the same reason, despite the fact this had happened. And I raised it immediately with the nurse who was doing it and expressed real concern and said, you can't do that, this is life-saving, they'll potentially die if we don't continue it, and so on and so forth. And it was busy, and that person looked quite distressed. And the action that followed was I was taken into an office privately by the senior consultant in that department. The door was shut. He shouted at me for 5 minutes about how disrespectful I was and I shouldn't be speaking to the nurses. And the first thing I had to do was go out and apologize. And I said, look, I'm really sorry. And of course but what did I actually do? And they said, you can't accuse people of not caring for the patients and looking after it like that. That's just not on. And I explained the situation we're in, and he said, I don't care about any of that. And you need to remember, I'm in charge of training, and your next job depends upon me signing off your training document. So you got to go away and do this. And I refused. I said, I'm more than happy to speak to people who are upset, but I'm not going to say that this was wrong. People's lives are at risk. And imagine I'm a house officer in the mid-90s talking to senior consultant. Said people's lives are at risk and this is not the way the hospital should run. And that was a hospital at the time, had a lot of dysfunctionality, and I did leave. I didn't stay on to do my training. And I finished my shift at about 4 o'clock in the afternoon, and I went back to my room. I don't cry very often, but I was sobbing for about an hour because I thought that was my career over. And I was angry and I was outraged that this was the injustice of it and the stupidity of it. And I wrote a letter to the person who was in that post, and I sent it to them saying what had happened, and that of course if people were upset, I'd be happy to meet them, but I could not and would not act differently or retract that I thought what they were doing was dangerous. And I didn't have a reply, but over the next couple of months I was taken to one side by several doctors of various grades, junior doctors as well, who'd obviously been spoken to, and said, look, you need to go and do this and have a word with that guy, because your next job might not happen. So I didn't know whether things were okay until August, when I actually started my next job in another organization. So that was horrendous. And and looking back from 2022 as a 50-year-old, and the world has moved on a hell of a lot, and that hospital has moved on a hell of a lot, and is a much better place to work now. And I've heard that from a range of sources, and I'm glad about it. But that was horrendous, and that, on the scale of whistleblowing, was pretty minor. That wasn't me going to the press. It wasn't me going on national TV. It wasn't me publicly humiliating the whole whatever. It was me speaking up and being threatened by somebody in power, and then realizing there was a kind of network behind that of how do you lean on junior doctors. And I never forgot that. It's not about forgiveness or anything like that. I just remember how horrendous that was. And that helped me, and Niki, I won't speak for too long, but that helped me a lot. Years later, when I was in a national role in a training program, and I met somebody in the context of that program who asked for my help because they found themselves in a bigger whistleblowing bigger whistleblowing situation. They came to me because I was somebody at that stage of my career who was senior, who was a mentor, who was looking after people. And I remember realizing this was the first time in my career I'd ever had to deal with somebody who was an actual whistleblower and was going through this. And they described all the emotions they were going through. It was similar to what I went through as a junior doctor, only about 10 times worse in terms of the situation they were in. And it was one of those moments where a guardian angel appeared. So as part of the training course, we had a gentleman called Sir Stephen Moss, who some of you might be familiar with. But Stephen is a highly respected nurse. He rose to be a nurse director and then a chief executive, and actually was the chief exec in the hospital I went to after my junior doctor year, and it was an excellent hospital. I very much enjoyed working there. But he was asked to become the chair of mid-staffs after they had all their problems, and the organization was in danger of disintegrating because of the terrible problems they had with quality about 10 years ago. And his job was to try and help the healing process and put the board back together. So Stephen appeared, had phenomenal instinct, saw me, came over to see me because he knew me a little bit. I was surprised he came over because he could see I was having a difficult conversation. I wasn't offended. It seemed natural to just say, you've arrived at an interesting time because we're having this chat. And I'd never be more grateful for somebody appearing stage left, because Stephen had clearly spent a lot of time speaking to people in that situation in his career, and in particular in mid-staffs. And I sat back and watched a masterclass of how do you support and how do you care for somebody in the moment, of somebody who not only had phenomenal natural empathy, but had been there and done it multiple times. And I think training programs are fantastic, but I'm grateful for the in the moment training I had from watching Stephen do that at a level that was just exemplary. So the good news is we've come a long way in 26 years. We're learning from the bad events and the good, but the emotional distress of being in situations like that, whether they're full-blown public whistleblowing, or even the kind of private behind the scenes bullying when you speak up or won't back down, is horrendous. And I think that all work to do to stop that is strongly to be encouraged. And I'm really pleased that you asked me to speak, Niki. And thank you for letting me speak about these things for the first time, because I haven't done that before. Thanks.
Thank you, Simon. Thank you for being so candid. And I think you've illustrated some of the key points that we really wanted to draw out of today's session already, in terms of what it feels like and what we can do to create a trusted environment, and how important it is to encourage people, because otherwise you're asking people to step off the precipice, and it's not fair, and it's not safe. So thank you. If we could move now to Stewart, if that's okay, Stewart.
Yes, absolutely. Although I'm not sure how I follow that, Simon. That I guess that sums up exactly why we're here today, is looking at people's ability to come forward and speak up, and everybody else recognising the bravery that it takes for somebody to do that. So my name is Stewart Hughes. I look after the Group Security and Investigations function for SSE. Part of that role involves financial crime, involves our conflict of interest register, and of course our speak up process, procedures and policy. I got this function around about 10 years ago, and it was a shambles. It was a tick box exercise, and for a FTSE 100 company that wasn't appropriate. And we clearly had to do something about it. It came on the back of a 7-figure fraud that was perpetrated internally against SSE, that resulted in a large amount of negative publicity and a lot of internal head scratching as to how things had come about and why we didn't find out about it earlier on in the process. There were a number of touch points that were there. So we basically destructed the process and rebuilt it from scratch. And as I said to Niki earlier on, that was a very difficult process for us, because back a decade ago only, there was nobody to speak to. There was nobody that was prepared to come forward and share their views, share their experiences, good practice, bad practice, so on and so forth. So we very much went about it in the blind. One of the reasons why I'm so passionate about sharing our experiences in these kind of forums is that, one, I can always learn from everybody, no matter what event we go to. But secondly, we've kind of fallen over quite a few times, and it's great that we're not in competition with anybody when it comes to encouraging speak up, when it comes to investigating crime or regulatory breaches, so on and so forth. Therefore, why not be open? And I've got a really good steer from our board that allows me to come along to these events and be really, really open. Therefore, ask your questions as you can. I've not been a whistleblower, but I have been a patient. So I feel that I've got a vested interest in you guys getting this right, and because the way I go about myself, I'm pretty sure I'm going to be a patient again. And to use an analogy, the first thing that you should always address is what you guys already know, and as far as I understand, it's instilled in you from the very first days in your careers, is that do no harm. And that quite simply is something that you carry into your speak up procedures as well. For those individuals that take that brave step to come forward and speak up, treat it as a one-time event. If you don't get it right first time, they're unlikely to come back. You have to make sure you get it right first time. You've got to display all of the attributes of a caring organisation and make sure that that individual who speaks up in good faith is protected, is cared for, is looked after. And you've got to display that. It can't just be words. You've got to follow that up with actions. And ultimately, I've got some notes all over my desk here of the things that I wanted to try and get across. But aftercare, I think, is what you guys are good at. But in terms of formatting that into a whistleblowing process or procedure, hopefully it's something that I can give a few nuggets of information on to assist you on the way. So Niki, again, if you don't interrupt me, I'll just keep on talking. So I think if that's good enough an introduction, I'll just stop there and let you move on.
Thanks very much, Stuart. And I think it would be helpful to come back to the a couple of those points, especially about the importance of getting it right first time, and also with reference to the aftercare and what that looks like in SSE and what you do around that. That would be really helpful to come back to.
Absolutely.
Thank you. And Sean, if we could just come to you now, that would be great.
Sure. Hopefully you can hear me okay.
Yep, we can. Thank
Excellent.
you.
Good. So thank you for inviting me. I've done these sorts of events before, actually, with the NHS on several occasions, interestingly. And what always strikes me is the stories that get told about people who've blown the whistle within the healthcare sector, and how strikingly different that is to where I work. And I always think myself incredibly lucky to work in an industry where speaking up is the norm. And I'm always shocked at how bad an experience some people have, actually. So I've been in aviation since I left school, and I was an engineer originally, worked on helicopters and big jets. Then after various jobs, joined the CAA about 28 years ago. So I've been doing this a long time now. But even back then, we had legislation that actually made it mandatory for engineers, pilots, air traffic controllers to report occurrences as they're described. So that came into force back in 1976. So we've had decades of getting used to this idea that speaking up when there's a problem or you're worried about something is the right thing to do. And I set up the whistleblowing process for the CAA back in 2008, where we receive whistleblowing reports from the industry we regulate, from civil aviation generally. But it was also at the head of our safety data department when the current legislation around occurrence reporting was rewritten in Europe back in 2012. So I was the lucky soul that went backwards and forwards to Brussels as the sort of the UK rep. And the thing that I think's really fundamental for any organisation, not just aviation, is why does an organisation have an internal reporting process? Why do you have a process for internal whistleblowing? Let's use that term. And there's two answers to that, and they are fundamentally different. I think where a lot of organisations are, it's to deal with the reports they receive. And that's, you say, yeah, of course, that's the obvious answer, isn't it? We have an internal process to deal with these whistleblowers that come to us. But I think where you want to be is you have an internal reporting process to encourage employees to speak up with the valuable information they have so that you can use that to improve. And that's what we try to promote within civil aviation. You don't have an internal reporting process to deal with these pesky whistleblowers that come along. As a board of an organisation, as the senior management team, you want this information because if your employees can tell you where the problems are, you have the opportunity to fix those problems and become a more profitable, a safer organisation. And I really feel strongly the key thing with any reporting process is that fundamental mindset. Are we doing this just to deal with these whistleblowers that keep coming along and talking at us? Or are we doing it because we want them to come to us and tell us this information? And that mindset really does drive the way that senior people in an organization behave. And that's really quite fundamental. The other couple of things that I think are key is feedback. Those organizations where I've seen problems with internal reporting, where the number of reports they're getting from staff is reducing. And in our industry, it sounds weird. We like to see a lot of reports. Some people measure success as not having many whistleblower reports. Of course, that's fundamentally wrong in my view. You want lots of information. So if you give feedback to every single whistleblower, every single person that reports something, that makes them know that lets them know it's important and it's worthwhile. And the other thing, of course, and it was touched on earlier a little bit actually, was just the awareness of doing this. You know, every member of staff in an organization needs to understand there is a process for speaking up and why it's a good thing to do and how they would be treated if they did speak up, even if what they're actually speaking up about is their own mistake. And that's a really mature process where if you can get them to report their own things, and that requires training, and every single member of staff, not just the obvious candidates. So in my industry, it's pilots and engineers, but in your world, the clinicians, it's not just them, it's also the porters and the cleaners. Everybody needs to know about this, and that's also really important. I think that's probably enough for me for the moment. Thanks.
No, that again, Sean, I think you picked up on some really key issues about mindset, the importance of feedback and numbers coming through and what that means, and this key issue about the level of awareness of the process within the system. So I think these are all things that we'll pick up in more detail. It strikes me that in that sense, it's similar to what the journey that we've seen around complaints handling, public service complaints handling within public services, including the NHS, where I think over the past 10 years, where there've been very clear standards and a clear process and a very clear message around valuing complaints, what you've seen over time is actually this the numbers that you're receiving become less and less important. It's just very much about knowing that the process is working properly and that people can access the process and they can work through the process. So as you say, Sean, low numbers doesn't tell you anything about how effective the system is working. It could be a really good thing, it could be a really terrible thing. It's not a very helpful benchmark. So perhaps if it's okay, if I could ask all of our speakers to now switch their cameras on so that we can have a bit more of a discussion around this. And I can see a couple of questions coming up in the chat, and please do feel free to continue to add the questions to the chat. But I've just got a couple of questions to maybe start us off, and I think it is just about you know, this theme of how you build a good speak up culture. So I think we all know what a good speak up culture isn't, but what do we think that it is, and what are the ingredients that make a good speak up culture? And maybe Sean, if I can come back to you, because you made this point about mindset. So we know what mindset we're looking for, but what do we do to build that?
Yeah, so every organization has history, and I think one of the challenges with building up a positive culture in this area is senior managers are often not trusted because of past actions, and that's quite a difficult one to get over. We tend to be judged by things. What amazes me is how often people remember events from 10-20 years ago, which puts them off behaving in the appropriate way today. So that's one of the challenges. But back to the point I made a moment ago about feedback. If we don't give the right feedback, if we give inadequate feedback, that feeds the cynicism, if you like, of staff, of whistleblowers. I mean, my experience with external whistleblowers coming to the CAA, where they've lost confidence in the internal process in their company, so they come to us to try and help, is when they first contact me, they're often very, very cynical about what we're going to do. There's this perception, possibly through the media, etc., that no one's going to listen, no one's really interested, and you really have to be positive and give feedback at every stage of the process and show interest in what they're saying and describe what will happen next to help build up that trust. So I'm probably putting out the challenges more than how to fix it. But if you can recognize those challenges and try and explain recent cases which have gone well, possibly, and you do give that good feedback, and it is one of those things that takes a very long time to build. Actually, it's not something you can do overnight. So it takes years to build and moments to destroy, unfortunately, but that's the reality.
Thanks, Sean, and I'll maybe come to Stewart next, because Stewart, you made a point about 10 years in, but it's still absolutely critical that you get it right first time, every time.
Yeah, absolutely. I couldn't agree with Sean more in terms of the ease at which you can self-implode and dismantle the trust and transparency that you build up over time. And it does take time. This isn't a quick fix. You won't fix this overnight. We are 10 years into our particular journey. And I don't think we are, if I'm honest, I think we're probably on the curve. We're not ahead of the curve in this environment. We're maybe on the curve, and that too might be a wee bit generous. For me, culture, there's two ingredients to it, and it's trust and transparency. These are the buzzwords that we're throwing around, but you have to get the trust and transparency in the system, otherwise nobody will use it. And it's a chicken and egg, right? Because you've got to be able to prove that you're trustworthy and that you will deal with things in an appropriate fashion. But people won't necessarily come forward until they know that you're going to prove that. So there's a balance there that has to be struck. For me, we speak about aftercare and how that has helped to develop the trust, because we're reaching out to these individuals at key touch points throughout their journey. And we've recognised that this is a journey, and it's one that very few of your contacts actually want to take. Once they've set the ball rolling, there's a high number of people that regret initially speaking up because of that fear of retribution. And that's the primary barrier for us, for people speaking up in the first instance. So the aftercare process is something that we've built, and we've recognised that actually you need to look after an individual through every stage of their journey. And we do that in a number of ways, but primarily by ensuring that we communicate with them, and we communicate with them from the moment that they speak up. And so we've got an internal platform, we've got an external platform as well, because we were very clear that an internal platform can be a barrier. If that's the only way that people can speak up, if there's not trust within your organisation, then they're not going to come and speak up internally. So there has been legislative change over the years that has detracted from that and allowed people to go elsewhere. But we were very clear when we set the process up that we were going to encourage an external vendor, or encourage people to an external vendor, with the view that that would allow our people to witness that, if you don't want to come and speak to us, we're okay with you going externally, for as long as we get the information. Because the key part, I think, that we've had a learning over the last couple of years is there's a massive mental health burden carried through the burden of knowledge, and it's significant. People are going home at the end of a shift, at the end of their working day, they're coming in the morning, they're carrying this burden of knowledge. And the earlier that they can offload that burden of knowledge, one, is better for them, and to pick up on Sean's point, two, is better for the organisation. The earlier you find out about this information, the faster you can act. And acting is taking care of the person as well. It's not just about the issue to hand, it's about the individual that's come forward. So the aftercare process reaches out at stage one. We reach out at 90 days after first contact, and we reach out at 180 days after first contact. And that is through either a phone call, where we can actually, if the individual is prepared to have their identity known and is prepared to talk to us, we do it that way. Or secondly, through the SafeCall platform or email, we send out a survey. And that survey is designed in 4 parts that encourages the individual to tell us about their experience. Did we take the time to listen to you? Do you believe that we asked the appropriate questions? Did you get all of the information that you wanted to get across to us across? Have you been told what will happen now? Have we made sure that we've got contact points for you? Are you comfortable? So on and so forth. And it goes through that process of day 0, ground zero, day 90, and day 180. We specifically ask about detriment. And that's helping to build trust, because we're asking if an individual does believe that they've suffered detriment as a result of speaking up. That's also important for us as an organisation, so we can understand what form that detriment's taking. Because it might be that there is no detriment suffered at all by an individual. They went for a promotion and didn't get it. They believe the optics are that I spoke up, therefore I didn't get that promotion. So we're able to guide people through that myriad of challenges following speaking up, that actually they can become paranoid. individuals
Yeah.
believe that they're being targeted when they're absolutely not being targeted. And so having that process, sorry, on you go.
I'm going to keep going with this line of questioning to Simon now, Stuart, but I'm going to come back to you on that kind of transparency versus confidentiality question, because I can also see someone's got a question about anonymity. So if we can move on to that next, but I just want to go to Simon now and say, Simon, you're hearing from people that have got a lot of experience in this area, and it's not to say, I think the conversation so far, it's not to say that the NHS doesn't already have a lot of experience in this area. We've obviously moved it on to another stage by introducing an independent national whistleblowing officer service. But I think it is fair to say that the purpose of this is to create a renewed interest and a revised system and a level of independence that we've not had before. But given what Sean and Stuart have both said around, there'll be a lot of history there, and the history will be different for every single organisation, and it takes a lot of time to build up trust. But conversely, we're saying what we need to make this system work is that openness and that curiosity, and that staff concerns being raised is it's part of business as usual, which is what an effective system looks like. I'm putting the really unfair question to you about how do we get past the history more quickly, because we don't have 10 years. We need to get this moving.
Thank you very much, Nikki. That's I was thinking of the answers to some questions, but your point about how do we get past the history more quickly, that's I'm going to try and just shift gears and say words, but I'll need to think that one through as I'm answering. So I think the first point is context here. I've, in current and more in previous roles, been struck speaking to board members who've come from other sectors and other industries, just how different healthcare is. And I certainly wouldn't say it's the worst sector or industry, but it's clear that others are much better. And in particular, it's almost around the whole area of, and forgive me, Niki, I'll use the wrong language here, but the sort of the continuum from raising a bit of a concern or just even giving a bit of feedback up to full-blown whistleblowing and that end of the continuum, if I can put it in those terms. The bar feels higher in the health service for a range of reasons, one of which is I think society rightly values the NHS specifically, and I don't need to spell out why, but if we look at things from the Olympic Games in 2012 and all these other things, and public polling and politicians' concerns about interfering with that bit of the public sector, the NHS is on a bit of a pedestal. As an employee, I see the positive in that, but I think it's a barrier sometimes in terms of people speaking up. I don't want to get into controversial areas like funding models and things like that, but I think the perception that somehow this is free, which it clearly isn't, is a bit of a barrier for people speaking up. And if you look at other sectors like university education, I was at university 30 years ago, and I've now got a child who might be going next year, and the way that the universities respond to feedback, engage, listen and learn and all the rest of it is quite different. And some of that is cultural, and some of it's because I think people are perhaps a bit more clear this is something you're paying for. But I think that there is a barrier from the level of just giving a bit of feedback on how an episode of care has gone right the way up to the continuum, the other end of the continuum around whistleblowing. So I think if we're going to get past the cultural issues of the last, get whatever how you put the cultural journey on warp drive, or however we're going to say it, I don't think it should just be at the end of whistleblowing. I think it should be across the whole continuum. And I think actually we'd avoid situations where people have to take the step of blowing the whistle. I'm not saying it's a negative one, but where people have to take that, if we create a culture that is much more curious and receptive to feedback and see the value of that. And I think actually being challenged by people from other sectors, be they non-executive board members or others or citizens panels or whatever, in a very, very, to say, here's what I'd expect and here how it is a good first step to doing that. I do also wonder whether there's an intergenerational aspect to this as well, because something that others are more expert on than me, but I'm recognizing, is the generation that are currently in their 20s and have grown. It's easy to blame social media for everything, but have grown up with social media and are much richer exchange of views for people who don't know each other, and sometimes a much more frank exchange of views about how you're feeling about things than I grew up with. I'm wondering how they're going to play into this debate, because when they speak up, they might do it with language and an approach that's much more challenging. And maybe my language and approach was more challenging in 1996 when I had the episode I recounted. But I do wonder whether there's something about the generation that have grown up with the internet and the social media and all those things as the norm and all they've ever known, and that exchange of views. There's probably a different way of speaking up and being candid and expressing your views in that might on the one hand raise the threat level for people of my generation on the receiving end, but actually there might be a positive there that these are people who are used to speaking up in a, you know, as part of a wider conversation, and how do we learn things from what they're sharing. So I suppose, having to try and get to your answer, I think we should I think we should explicitly do more about day-to-day feedback, genuinely getting rapid feedback, even if it's just, can you tell me one thing about the encounter you just had, or every third patient you see in clinic, is there one thing that we could do that make things better, and drop the barrier of feeling threatened by that. I think we can learn from, I know of private companies who train their management trainees specifically in getting and receiving feedback in a way that it lowers the level of threat and push back against that in a way that makes them better at their job. And I think we could do that through medical schools and clinical education and so on. But I think if we do it across the whole spectrum and maybe almost emphasize the routine getting of feedback and not feeling like you're being told you're terrible at your job, that will probably help lower some of the barriers to how do we deal when people express more serious concerns. It's not one solution, but that maybe the training will be accelerated by doing it at the lower intensity levels of concerns. It'll make it easier at the higher intensity. So I hope that's a very hard question. I hope some of what I've said is helpful, but I'd be keen to hear what the more expert people on the call think about that and whether that works in other industries as well. Thank you.
Thanks, Simon. And I think the point about mechanisms for feedback, how we build mechanisms for feedback into our daily working lives, is a really valuable thing for all organisations to think about. Because for me, I think for speak up to work as part of day-to-day practice, it is about, well, what mechanisms do we have that allow for that, and where have we got gaps? I think one of the differences perhaps across professions is in terms of how decision making works. So in some professions, it is necessary at times to have a very top-down decision making process, and I think it's about, for organisations, knowing when you're in a, you have to be in a top-down decision making process, and when you can step out of that and there's room for feedback and discussion. So I think sometimes it's because organisations that are top-down decision making and a lot of their processes perhaps find it harder to switch into that feedback discussion mode, and that might be an answer as to why it can vary across different professions. But that's just a view, one view. I'm conscious that we've not talked very much about the transparency element, and one of the dilemmas I think that there is around this area is this issue about the need to be transparent, but obviously to protect, very, very highly protect confidentiality, and not just of the person raising the concern, but potential witnesses that are within the process, for the individuals that whistleblowing concern may be raised about as well. So I was just going to actually come back to you, Stewart, because you were moving on to talk about anonymity as well, and I can see that there's been a question there about how much is the confidentiality protected of people that go to your independent service, and whether there are other thoughts that you have about that dilemma between transparency and confidentiality.
Okay, difficult question. So let me give you our experience, I guess. So first and foremost, whistleblowing in our environment is very difficult. It's very difficult to separate out a public interest disclosure from a grievance at the outset. Okay, so our whistleblowing register is primarily concerned with a public interest disclosure under the Public Interest Disclosure Act of 1998. And ultimately what that looks at is the nature of the inverted commas offence and the status of the inverted commas complainer ultimately. So are they a worker and what is the nature of the offence? It's very loosely fitting criteria, but that's what goes on to your whistleblowing register. We took the active decision that everything would go on the register regardless of what we initially thought it was, such as a grievance. So if it came through and it was evidently a grievance, we wouldn't send that away internally or externally. We would encourage all the information to be gathered in the same way, and then we would make that assessment at what we've referred to as our initial triage. It's quite good that I'm using terminology you're all familiar with, but our triage is the first step in protecting the anonymity of an individual. So the first part of the question there, how do we do that using the external provider? It's actually easier, believe it or not, when it comes to the external provider, because that individual, through the process, whether that's from one of our global locations, they get to speak to an individual in their native tongue. First and foremost, we don't have any challenges with terminology, phraseology, etc. They're at the very outset given the opportunity to tell us whether or not they want to be fully non-anonymous, if you like, and they're happy for us to speak to them. The other side of that is that they're fully anonymous and they just don't want us to engage with them in any way, shape or form. They're giving us the information and they want to step away because they've got a variety of reasons. And we ask them what those reasons are, fear of retribution, so on and so forth. And then through our external provider, there's that ability for them to make themselves known to the provider, but not then have that information passed on to the organisation. So when you go external, you give all the information, it's passed on to my team, we go through a triage process. So we are able to communicate, and we refer to these people as active communicators. We're still able to communicate with them by leaving messages on their account with our external provider, which they can log into, they get an individual unique PIN number, and we can communicate with them without knowing who they are. And the success behind that is that you can still ask questions, you can get further information, you can get answers to some of the information that's missing, that is preventing your investigation from progressing, for example. So from that perspective, that starts to build a bit of trust there as well, because there is a bit of a transparency around, I still don't know who you are, but I'd like you to answer the following questions. This is the only way I can do this. Check back in a couple of weeks' time, see if there's any further updates, and we can communicate on progress of an investigation as well, where possible, because ultimately things can move from the register into the grievance environment, because we can communicate with that individual to say the resolution you seek from your complaint actually needs to go through the grievance procedure, stays on the register as closed and moved into that grievance environment, but we then track that all the way to conclusion on the whistleblowing register as well, because it started its life there.
That's great. Thanks very much, Stuart. I'm going to move on because I'm conscious of time, but that's a really interesting model. It's obviously slightly different to the model that we've got going on with IMWO, but that's really interesting to hear that's how you manage it. Sean, could I maybe come to you in terms of how you balance, and I appreciate you're acting in a regulatory capacity as well, so again it might be slightly different.
Yeah, so I guess there's two ways to look at it. One is the reports we receive directly, so whistleblowing reports which come directly to us from our industry. The other one is the way that we regulate that industry as far as their internal processes are concerned. So confidentiality is key in both of those situations. So how does transparency fit? Well, the process and the use of the information should be transparent. So everybody involved knows what's going to happen and how it happens. But at an individual case level, it's confidential, quite clearly. So another thing that should be as transparent as possible is back to feedback again. So when we're communicating with the reporter about the specifics of their concerns, we want to be transparent and open. And in that context, transparency really translates directly into honesty. You know, transparency means you aren't, you know, you can be telling somebody something which isn't completely honest. They may come to you with unrealistic expectations. So if what they want, their expected outcome is completely unrealistic, well, let's be honest about that. If what they're worried about actually isn't a problem, give them feedback and explain that. So the transparency, honesty thing, I think, is also important here. And recognizing that sometimes a whistleblower has unrealistic expectations, and if that's the case, you need to manage that and explain to them, I'm sorry, but what you're suggesting there, you're never going to get that, and explain why. So it's treating them like an adult, and having that honest discussion is really key. But confidentiality is really quite fundamental. So we treat all incoming whistleblowing allegations confidentially, and it's different to anonymous. Okay, anonymous means we don't know who they are, and that really inhibits communication. Confidential, yes, we treat them all confidentially. We'd never tell an organisation who would come to us. In fact, usually we don't even tell the company we've received an allegation. We just turn up and start looking at stuff and don't tell them why. But another element of this transparency is maybe sharing successes at an organisational level. We encourage organisations to identify those cases where, you know, a member of staff has raised a concern about something, and that's resulted in a really good outcome for the business or for their colleagues. So they've raised the point that this piece of equipment is no good anymore, it never works properly. That's looked into, a new piece of equipment's bought, and everybody now has an easier time of it. You know, a bad example, but so those sorts of successes which you can share openly, because the whistleblower, the person who's raised the concern, isn't bothered about confidentiality. Great, you know, if you can get them to maybe write it up themselves, be involved. You know, they could write something for the company magazine or for the intranet or whatever the company has. That's another really good way of selling the benefits of speaking up to everybody else in the company. I reported something, it worked really well. You know, that's a good idea.
Yeah. Okay. Thanks, Sean. And I think that piece about managing expectations and honesty through the process is a really good one. I think that you've both really clearly illustrated, you know, that it is possible to be transparent and protect people's confidentiality. I'm not sure if people are aware that IMWO have published their first investigation report, and it is on our website. So again, I think it's really important that you're putting out reports. Obviously, always making sure that you're being very careful about avoiding identification through implication, especially of witnesses. And some of the feedback that we've had in terms of our process and that first investigation report, which is, I would encourage everyone to go and read if you've not had a look at it yet, I think is about making sure that you are thinking really carefully about the potential to identify witnesses as well as the individual whistleblower, and also keeping a very careful tracking sheet of what information is being shared with who and when, so that you're very clear that you're only releasing information to the people on a need-to-know basis. So nobody that doesn't need to know shouldn't be on that tracking sheet, and that sequence of how you're releasing that information and what you're communicating back to the whistleblower as well, so that they understand what's being shared and when, is really critical, and documentation around that is really critical. So that, I think that was really helpful. Simon, I'm not sure if there's anything more that you wanted to add on that transparency and confidentiality piece.
No, I just put a comment in. I think the point about expectations was very well made. The other thing I'll just throw in quickly is, we are in a healthcare is complex in that people from different organizations work together in the same team. If you're blowing the whistle on somebody who might feel like a member of your team, but they're actually working for a completely separate employer, I can see how that could be frustrating for the individual, because they might not necessarily get the same feedback as if they were in the same organization. I don't know if you think that's an issue or not, Niki, but it's one that's been raised with me before. Sometimes when concerns are being raised, is not being part of the same organization can limit the feedback you get. But do you think that's likely to be an issue or not?
I think where you've got multidisciplinary teams, particularly, and so, for example, where we've got health and social care teams, where you've got some individuals that are not NHS employees, so they wouldn't necessarily fall under the IMWO scheme. That then can create some challenges. There's quite a lot of guidance around that from the IMWO team, and they can help guide people through it. So yeah, I think that is an issue. I'm just very quickly looking back through the questions that we've received, and I think we have actually managed to, one way or another, cover them. Other than a question from Mina, which, Mina, I'm really sorry because I don't know the answer to this, but do NHS boards have conflict of interest registers? I'm assuming that the answer is yes, but I don't know the answer. So Simon, do you maybe help me out there?
Can I? It's an interesting one. So board members, if you look on NHS boards at the board members register, they all have registers of interest, and directors who attend board but not board members, which is the situation I'm in, we usually are on the boards as well. Healthcare Improvement Scotland's is particularly comprehensive because obviously we're in a sort of regulatory function as well, where we try to be very transparent. There is a live debate triggered by or live discussion triggered by Baroness Cumberledge's review of safety issues around medical devices as to whether the medical profession should have a declaration of potential conflicts of interest where I'll try and phrase this correctly, if you like, commercial or possibly even research, but probably commercial interests might impact on quality of care. So to be clear, if you're an investor or a shareholder in a company that's making a medical device that's part of your clinical practice, then the public should know about that. That was one of the recommendations in Julia Cumberledge's review, and I'm not sure quite where that's going in terms of being implemented, but I think it has been accepted by the governments in the UK. So that's just about the medical profession.
Stewart, were you going to come in? We can't hear you, Stewart, for some reason.
Apologies, I'll put myself off mute. Yeah, just for closure for that piece, I just wanted to very quickly touch on the risk assessment piece that we do at the triage stage where your contact first comes in, and some of the questions that you ask yourself when that contact comes in is how easily could your complainer be identified from the information that they are providing? Could they be identified, and if so, how easily? Who are the persons involved? What do you know about these individuals in the first instance already? Could there be upwards or downward pressure applied when you're looking through the cause and effect? The risks presented by conducting an investigation. So could the investigation reveal the identity of an individual that needs to be protected? In your environment, I can see that being, a situation that somebody's in an operating theatre, somebody does something, and it's going to be dead obvious that it's going to be one of only a handful of people that could have blown that whistle. So having that risk assessment process up front before that's allocated for investigation assists with the protection of that individual, because you're able to have conversations with them potentially up front that says, yes, this will move to an investigation. You are going to be identified. There's a significant risk that you could be identified through that process. Here's the mitigating steps that can be put in place, or here's the protections that can be put in place as you move through that process. So it was just to touch on that at the very start of your process. Identify what risks are there, record them on the risk register as you move forward.
I think that's really helpful advice, Stuart. Thank you. In terms of thinking about it almost as a separate first step in your investigation process is actually to carry out that risk assessment. So I think that's really, really helpful advice. I'm conscious we're now at 4 o'clock. I'm really sorry if we've not got to everybody's questions or not addressed those. As I say, our IMWO team are there to give advice around the standards, but I think we've had some really, really clear messages coming out of today's session. So I think we all recognise the courage that it takes to raise concerns, that we need to try to create cultures that see speaking up as part of business as usual, that are it's seen as a positive action and in the interest and the benefits of all within the organisation and those using it. We have acknowledged that it's not just about encouraging people to speak up, but it's what we then do with that so that we can clearly evidence that we've taken action and that we've followed up, both in terms of the findings, but also that aftercare that Stuart talked about is so critical when we're asking people to be brave and take that step forwards. We need to think about how do we benchmark, and numbers aren't necessarily the answer for me. I think one of the key indicators is you know, how the proportion of your staff that say that they understand what your procedures are and that they would happily use them. So you can monitor that through things like staff surveys, because I think it's firstly about people need to have the awareness of the processes, but they also have to have that trust and confidence in using them. So I think this session in and of itself has been really helpful in terms of raising awareness, hopefully, and sharing some thoughts from people that have much more experience in this area than myself, certainly, about how we can take this work forward. So, as I say, I know we can't give at SPSO, we always like to give a round of applause, and I appreciate we can't do that, but I would like to give a round of applause to metaphorically to our speakers today. Thank you ever so much for your time, and I hope everyone has found that useful. Thank you.